So this is a specimen where we are going to see anterior compartment of leg, medial, lateral, inferior, superior. This region is anterior compartment of leg. So the main muscles here are from medial to lateral, tibialis anterior, extensor hallucis longus, extensor digitorum longus, and this last muscle here, that is peroneus tertius. So once again, tibialis anterior, extensor hallucis longus, extensor digitorum longus, peroneus tertius. Between extensor hallucis longus and extensor digitorum longus, you may see some structures. So this structure here is that is anterior tibial artery or anterior tibial vessel, and a nerve which is lateral to it, that is deep peroneal nerve. So in the anterior compartment of leg, all these muscles and structures are supported by a retinaculum that is called extensor retinaculum. There are two retinaculum, one is superior extensor retinaculum, other one is inferior extensor retinaculum. Another specimen where this is lateral, medial, superior, inferior. Anterior compartment of leg can be seen here. The muscles from medial to lateral are tibialis anterior, extensor hallucis longus, extensor digitorum longus, peroneus tertius. Between extensor hallucis longus and extensor digitorum longus, you may see the blood vessel, that is anterior tibial artery and vein, and this is deep peroneal nerve. So we are going to see the anterior compartment of leg once again. This is another specimen. Medial, lateral, inferior, superior. The muscles from medial to lateral are tibialis anterior, extensor hallucis longus, extensor digitorum longus, peroneus tertius. Between extensor hallucis longus and extensor digitorum longus, we can see this structure. This is anterior tibial vessels. And a nerve which is lateral to it, that is deep peroneal nerve. This is anterior tibial vessel and this is deep peroneal nerve.
Okay, stop.
You can see this nerve. This is superficial peroneal nerve. Superficial peroneal nerve is arising from the peroneus longus. This is peroneus longus. So this nerve is actually coming out from the peroneus longus. It is a branch of common peroneal nerve. So this is anterior compartment of leg in another specimen. Lateral, medial, inferior, superior. So the muscles are from medial to lateral, tibialis anterior, extensor hallucis longus, extensor digitorum longus. Peroneus tertius is missing in this specimen. Between extensor hallucis longus and extensor digitorum longus, we can see the structures here. This one, this bluish area here, this is your anterior tibial vessels. Lateral to that, a nerve, that is deep peroneal nerve. So here this is dorsal venous arch formation, and medially dorsal venous arch is going to continue as great saphenous vein. Great saphenous vein is going to continue on the thigh, and it is going to drain into the big vein here, that is femoral vein. So this is your great saphenous vein. Great saphenous vein is usually accompanied by saphenous nerve. And on the anterior compartment, you can see here this nerve. This is the superficial peroneal nerve, which is piercing the peroneus longus and coming out to supply the anterior aspect and the dorsal aspect of the foot. So this is again anterior compartment of leg. We are seeing another specimen: medial, lateral, inferior, superior. So in this specimen you can see nicely the superior extensor retinaculum, and here this is the inferior extensor retinaculum, which is like a Y-shaped band. So stem of the Y, and you can see the division of Y. And here this is superior extensor retinaculum. And this structure here, that is superficial peroneal nerve, which is piercing peroneus longus. And below the extensor retinaculum, we can see the structures from medial to lateral. This muscle here, that is tibialis anterior tendon, and here this is extensor hallucis longus, extensor digitorum longus. Again in this specimen, peroneus tertius is missing. You can also see this vein here. So we were discussing here the structures, that is the anterior compartment, and when you go to the medial side here, this is the medial malleolus, just anterior to the medial malleolus, about 2 to 2.5 cm anterior. You can see the beginning of great saphenous vein. Great saphenous vein continuation can be seen on the leg, and it is reaching the knee. From there it is going to continue upwards, and it is going to drain into the vein, that is femoral vein here. So this is the great saphenous vein, which is also known as long saphenous vein, which is a continuation of the medial end of the dorsal venous arch. This is the sole region. This is plantar aspect of the foot, also called as sole. Medial, lateral. This is the heel region, and these are the toes. So first we will see the deep fascia modification, that is the plantar aponeurosis. So plantar aponeurosis is cut. Then we will see the muscles of the sole, which are arranged in 4 layers. The first layer consists of this muscle here, which has been cut here. This muscle is called flexor digitorum brevis. So this is flexor digitorum brevis, this one. Laterally you can see a muscle, that is abductor digiti minimi. Medially you can see another muscle here, that is abductor hallucis, this one. Now when you cut the first layer of sole, now we are cutting the flexor digitorum brevis. We can see the muscles of the second compartment. So this muscle here, this glistening fibers here, that is flexor digitorum longus, which is dividing into 4 tendons. In between the white tendinous area here, you can see some pinkish area, that are the lumbricals. So these are the lumbricals. Okay, so flexor digitorum longus, then lumbricals. Then you can see another muscle which is attached to the flexor digitorum longus, this part, this area, This is another muscle that is called flexor digitorum accessorius. There is one more muscle medially in the same layer, this one, that is flexor hallucis longus. So the second compartment muscles are flexor digitorum longus, lumbricals, flexor digitorum accessorius, flexor hallucis longus. Now when we cut this area, this muscles, we can see the next compartment. Before that, let's see a nerve here. This nerve here is called medial plantar nerve. And here also you can see some nerves, that is lateral plantar nerve. So you cut the second layer of the sole. This is flexor digitorum longus, we are cutting it. Then we can see the third layer, that is here. This muscle is adductor hallucis. There are two more muscles in the third layer that are located here. One is on the medial side. So this is the hallucis longus. Once you cut that, you see another muscle here. This is flexor hallucis brevis. In the same layer, laterally, you can see here another muscle. This is flexor digiti minimi brevis. So the muscles of third layer are this one, that is adductor hallucis, flexor hallucis brevis, and this is flexor digiti minimi brevis. Now, after you cut the third layer, this is the adductor hallucis. You cut and reflect it. You can see this area. There are muscles here. These are the interosseous muscle. There is a white color area here, tendon here. This one, that is tendon of peroneus longus. Layer muscles. Fourth layer muscle. This is your interosseous, dorsal and plantar interosseous, and this tendon here, that is tendon of peroneus longus, and this one, that is tibialis posterior.